Management-related diseases of farm animals, the role of non-specific defense mechanisms in multifactorial disease resistance, and effects of environmental factors on the defense mechanisms. So, for the defense mechanisms in multifactorial disease resistance, we have surface protection, which prevents the pathogen from entry, and then we have non-immunological, such as skin flora, low pH, peristalsis, and mucus, and immunological, such as IgA, which is an antibody that prevents pathogen adherence. And then there's also the neuroendocrine immune network, which coordinates specific and non-specific defenses. For the environmental effects on defense mechanisms, for the skin we have barriers with resident flora and disquamination and low pH. The risks are when it becomes wet, it disrupts the flora and infections can occur, especially in the case of foot rot. For the intestinal tract, the flora composition, it's mainly 90% lactobacilli, bifidobacteria, and these support digestion and block pathogens. The escort flora is around 1 to 10%, and this is E. coli and Enterococcus. And the residual is 0.01%. These are facultative pathogens such as Clostridium and Salmonella. The risks are stress or high gastric pH or spoiled feed, which leads to dysbiosis and disorders in the case of swine dysentery. And for the respiratory system, the defenses are the mucociliary escalator, which removes particles, and the macrophages, where phagocytosis and cytokine production removes pathogens, and antibacterial agents, such as lysozyme and lactoferrin. The risks are poor ventilation and toxins impair defenses. For the mammary gland, the barriers are sphincter muscles and keratin plugs. The milk defenses are lysozymes and lactoferrin, and the risks is when there's poor hygiene, which increases the risk of mastitis. For the maternal immunity in newborns, it's influenced by the timely colostrum intake and antibody absorption and environmental management. And for the genetic determinants of immunity, breed-specific differences, such as immunity traits vary between Belgian landraces and Durocs for leukocyte activity, and then selective breeding enhances disease resistance. And for nutritional influences on immunity, energy supports acute phase proteins and immunoglobulins, and nutrients such as vitamin E and C and minerals such as selenium and zinc protect against stress and support immunity. And the immunosuppressive factors are medications such as glucocorticoids, toxins such as mycotoxins and pollutions, and pathogens also suppress immunity.